Good to have you with us. You're watching The Big Story with me, Avni Raja. And on this show today, we're going to focus on the COVID spike that we are seeing in some of the big cities across the country after the Diwali festivities. But first, before we get to that, here's some breaking news coming in. Prime Minister Narendra Modi holds a review meeting with Home Minister, National Security Advisor, Foreign Secretary and top intelligence establishment over Nagrota encounter. It was found that the terrorists were planning a big attack on the anniversary of 26/11, the 26/11 terror attack as per government sources. That's the breaking news coming in. This is a review meet that was being held by the Prime Minister and we understand from sources that terrorists were planning to attack on the 26/11 anniversary. And let's now get to our top focus for this hour, where we're focusing on three big cities, in fact, that have seen a COVID spike recently post-Diwali celebrations. We're talking about Delhi, Ahmedabad and Pune. Meanwhile, even Mumbai is among the cities that has seen a slight spike in COVID cases, but that is also as a result of the increased testing in the city. But the national capital continuing to battle a massive surge of COVID cases, with over 7,000 cases being registered in the last 24 hours. Pushing the infection tally to over 5 lakh. The Delhi government is scrambling to contain the spike in cases by taking a number of steps. Experts feel that Pune also could see a further rise in cases. Meanwhile, Ahmedabad has put in place a curfew for the weekend beginning tonight. Meanwhile, like I pointed out, Mumbai also seeing a slight rise in cases. But let me welcome all our reporters who are going to join us from the various cities to tell us the ground situation. We've got Mayuresh joining us from Mumbai. We've got Disha from Ahmedabad, and we've also got Ayushman from Delhi. Let me, in fact, first go across to get the situation as far as Delhi goes. Ayushman, what can you really tell us in Delhi that's happening at this point in time? We have seen, for example, one big step being taken is that the penalty on masks being increased to 2,000 rupees from 500 earlier. Door-to-door surveys have also started to control the alarming number of positive cases, ICU beds being ramped up. But what are you seeing on ground? Because the biggest issue here is implementation of the COVID norms.
Yes, Avni. In fact, my camera person Wasim will show you that this team of Asha workers, you can see in one hand they have the thermometer, the thermal temperature is being taken by that, and the senior citizens and all those people who are in the upper age group, they are being provided this oximeter, which normally gives the range of the oxygen level in the body, and the details are being taken. In fact, this door-to-door survey, in fact, house-to-house survey is something that is coming after the MHA's direction. And in fact, if I can speak to one of the person who is doing this, ma'am, यहाँ पर आप लोगों का focus, ma'am, अभी क्या है यहाँ पर?
यहाँ हम सबका नाम पूछ रहे हैं, हेड ऑफ फैमिली का नाम पूछ रहे हैं, जितने भी घर में मेंबर हैं उनका नाम पूछ रहे हैं। उसके बाद उनका थर्मामीटर से चेक कर रहे हैं किसी को बुखार तो नहीं है। उसके बाद अगर किसी को बुखार है तो ऑक्सीमीटर से चेक करेंगे कि उनका ऑक्सीजन लेवल कितना है। बाकी घर में अगर कोई बुजुर्ग है तो उसका ऑक्सीजन मीटर से और दोनों चीज़ से चेक करेंगे उनका भी।
इलाके में मैम कितने घर आप लोगों को दिए गए हैं सर्वे करने को, और कितनी टीमें बनी हैं?
टीम बनी हुई है, 9 टीमें बनी हुई हैं, और पर डे हमें 30 घर करने हैं। 30 घर करने हैं पर डे हर एक टीम को।
मैम, अभी जैसे अब आइसोलेशन के पेशेंट्स को भी चेक करना है, कोरोना को लेके मन में संशय रहता है, थोड़ा डर लगता है, पीपी किट वगैरह दिया गया है, क्या हाल है?
नहीं, सब कुछ हमें दिया जा रहा है, पीपी किट भी दिया जा रहा है, मास्क भी दिए जा रहे हैं, सब चीज़ दी जा रही है। और रही डर की, अब डर तो खत्म हो चुका है हम लोगों का, क्योंकि हम साल भर हो गया यही करते करते, तो हम लोगों को तो डर खत्म हो चुका है। बाकी जो लोग डरते हैं तो हमें ऐसा कुछ नहीं है, हम अपनी सेफ्टी खुद करते हैं।
आइसोलेशन के पेशेंट्स के लिए क्या कहा गया आप लोगों को, आइसोलेट करने के लिए पेशेंट?
सर, उनको हमने सब कुछ पहले ही दिया होता है। उनको घर में हम 14 दिन के लिए, 17 दिन के लिए क्वारंटीन करते हैं। उनके घर में जितने भी मेंबर हैं वो 14 दिन के लिए घर से बाहर नहीं निकलते हैं, और जो पेशेंट है पॉजिटिव वो 17 दिन के लिए घर से बाहर नहीं निकलता है। उसको हम ऑक्सीजन मीटर देते हैं, जिससे वो ऑक्सीजन चेक करता है, अपना ऑक्सीमीटर देते हैं उसको, जो ऑक्सीमीटर चेक करके वो बताते हैं, और हम भी उनका टेस्ट करके बताते हैं कि भाई इतना ऑक्सीजन है। अगर उसमें उसको कोई यानी बुखार या कुछ ज़्यादा प्रॉब्लम होती है तो हम उसको हॉस्पिटल में कर देते हैं।
ओके। So there you heard, Avni. This is the procedural that these ASHA workers are adopting here. But if you see the current situation, around 14 lakh households are to be surveyed like this, in this method only, and a quarter of, almost a quarter of Delhi's population, 58 lakh people are to be surveyed. If you see the situation right now, there are over 4,400 containment zones and densely populated area. If you include in that, the Delhi government has said that in coming 5 days, all these areas will be surveyed, and the report in next 5 days will be given to the MHA as well as the Health Ministry to assess as to what can be done in the coming days to control the number that we are witnessing in the national capital.
Well, that's right, Ayushman. So a lot of steps are being put into place. We'll have to wait and see when the numbers start actually coming back into control. But let's now turn our attention to Ahmedabad, where the administration has decided to impose a curfew starting 9 p.m. tonight until Monday morning at 6 a.m. During the weekend, only shops selling milk and medicines will be allowed to remain open. Ahmedabad has witnessed a steady rise in COVID cases since the beginning of November. And this is important because the fact is that Ahmedabad is the first city to go back into a lockdown-like mode after restrictions were eased across the country. And Disha is joining us from on ground to give us the situation. Disha, over the last couple of days, the city has been looking at more than 200 cases daily for the past 1 week and 246 cases reported in the last 24 hours. What can you tell us about what's happening on ground in terms of the COVID norms in response to this curfew that has now been called for the weekend?
Well, Avni, for a city of Ahmedabad, which has been reporting only about 120 to 130 cases on a daily basis till about last month, this month, if all of a sudden the cases go double, it is definitely a worrisome situation for the government, because this is the first time that they are looking at numbers going above 250 since June. So that is why it is alarming. And there are several reasons to it that the government says. Firstly, that during the festival period and before the festival period, markets were flooded with people. And over there, lack of social distancing and people not wearing masks. And just few hours before the complete lockdown, you are looking at a similar situation here in the city of Ahmedabad. Here we are in Manik Chowk, and because Manik Chowk is pretty much huge, it covers almost 5 kilometers. And you can see here that today as well, just before the lockdown, people are here out on the streets again, not wearing masks, not maintaining social distancing. You can see that how people are, shopping in very close proximity to each other. And this is what the government time and again has been really warning people not to do so. You can see even small kids here. The parents have not really, actually given the kid also the mask to wear. So this is the kind of situation that the Ahmedabad city is witnessing, and that is why we are looking at a surge in the cases. So to curb the spread of the infection in the city, they are now actually calling out for a weekend complete curfew. Starting from tonight 9 p.m. to Monday morning 6 a.m. A 57-hour curfew will be imposed in the city of Ahmedabad, where only milk and medical stores will be allowed to remain open. All of these markets that you see, this was a similar situation during festival and before festival as well, which is leading to this particular decision. Apart from that, on the health grounds as well, because currently only about 40% of the beds are vacant.
Right.
And the government believes that if people are out like this, not really maintaining, then it will be a difficult situation for days to come in.
All right, Disha, well, that's the situation as far as Ahmedabad is concerned. Let's also quickly turn our attention to Mumbai as well. There has been a surge in COVID cases post-Diwali. Yesterday, 924 people tested positive for COVID. Mumbai Civic Chief cites increased testing behind the reason, as a reason for the spike. But let me, in fact, go across to Mayuresh, who's joining us for more on this. Mayuresh, schools also in Mumbai are going to remain shut until the end of December. That's the call that's been taken. What can you tell us?
Absolutely, the BMC has taken this call to shut the schools until 31st of December because somewhere BMC feels, or BMC is of the opinion, that a lot of people are coming from Delhi and other states, and there is a chance that the numbers of COVID positive patients will go up. And we heard the BMC commissioner also, who clearly said that they have basically increased the testing in Mumbai city, and that's why the numbers are going up. So considering the current situation in Mumbai, now the BMC has taken this decision to not to open the school before 31st of December. The schools were earlier supposed to open on 23rd of November, but now that has been extended to 31st of December. Back to you.
All right, Mayuresh, Disha and Ayushman, thank you so much for joining us with all of those details. And a quick word on Pune as well, where there has been a steep surge in COVID cases post-Diwali. The daily caseload touching 789 in the last 24 hours. At least 400 to 500 cases being reported prior to Diwali this month. Pune, which recorded the highest number of COVID cases around September, saw a similar spike in cases after Ganesh Chaturthi as well. All right, let's now get in some more perspective as far as what we are seeing across several of these cities at this point in time. I'm being joined by Dr. Anish Sinha, Associate Professor, IIPH Gandhinagar, on the show. Thank you very much, Dr. Sinha, for joining us. What is your first, understanding or reaction to what we are seeing? Because we have seen, across the world, some of the other countries going back into lockdown stage, seeing a spike in cases. In India, is this beginning of something like that, where we are going to see a spike in cases going forward?
Yeah, like with great efforts from government, the administration, and the cooperation from the general population, we were able to bring down the cases, daily cases, and the pandemic looked very much well in control also. However, the recent spike of cases in Ahmedabad, Delhi, Pune, Mumbai, and maybe more bigger cities will follow soon. So the biggest reason behind all this thing was actually the pre-Diwali, that the pre-festive shopping and gatherings at the markets. That was a big reason. Even the visuals that you were showing now was very clear that people are have forgotten the COVID preventive measures like social distancing. Mask was also not there with many people. So all this led to a surge in cases. And then what to do now? Because the cases have increased. Like in Ahmedabad, it's over 200, 240 cases in the last 24 hours. So we are getting back to what we did in April, May, when the cases were rising, like something short of a lockdown. We can call it as a temporary curfew is there, but then this will definitely help in reducing the cases. And because we have to look into the hospital availability and beds also. So that is also being surged with night curfew imposed in Ahmedabad, weekend curfew in Delhi. The screening is increased, house-to-house survey to screen out and ensure those affected get the treatment at the earliest. The Mumbai also, they have increased the testing, and so these are the methods that are being deployed at different places.
Right. So, Dr. Sinha, do you believe that, we are seeing the city of Ahmedabad go back into a lockdown of sorts with this weekend curfew, and this is something that we were seeing earlier on in earlier months where several cities would go back into localized kind of lockdowns. But do you see that as perhaps the only solution or one of the solutions to sort of curb this spike in cases? Because what we are seeing in Delhi also is a big cause of concern.
Yeah. See, the biggest thing is now the people should understand that it's we have gone through a very tough time. Still, the COVID is not over. It's only the unlocking has been done. The virus is still there. So people should understand. And the administration may resort to localized sort of a curfew or a lockdown. It will be localized based on the needs, maybe there in some cities. So, and people should actually understand and follow the COVID preventive measures, should go out of the house only if it is really essential. Otherwise, should avoid going out. So that will be better in controlling the recent surge in cases.
Right. And Dr. Sinha, just a word on the situation in the national capital at this point in time, because we're already seeing the spillover effect happening in surrounding areas. This is a real big cause of concern as well. Do you think that the steps that are being taken right now with regard to surveillance, obviously ramping up of health infrastructure, is all of that going to be sufficient to bring the number of cases under control? Because 7,000, 8,000 cases a day in a city like Delhi is extremely worrying.
Yeah, it's really a difficult and tasking time for the administration also. So what they're doing is the surveillance to isolate cases and put them on treatment at the earliest if required, the surging the capacity of the hospitals and all. But I think because this surge is too high, some localized sort of an evening or a night curfew can also help the administration in reducing the cases, or something like Ahmedabad's weekend curfew can also be effective if the administration thinks for that, imposing the weekend or the night curfew. That may also help them in reducing the cases to a certain extent.
All right, Dr. Anish Sinha, thank you so much for joining us and giving us your perspective on this situation that we are facing in many of the big cities. But the important takeaway here that what's happening in Delhi and the Ahmedabad as well, the curfew in Ahmedabad is a grim reminder that the COVID battle is far from over, and maintaining COVID norms is really the need of the hour. In some news that's coming in, Delhi Chief Minister Arvind Kejriwal has tweeted after meeting market representatives. He says that their anxieties have been addressed. The government does not wish to shut any market, and the Market Association has assured him that anyone who is not wearing a mask will be provided free masks as well. Shops will be asked to keep spare masks as well as hand sanitizers. And with that, it's a wrap on this edition of The Big Story. Thanks for watching. Stay tuned to Mirana.